Hi, I'm Steve Adubato. Everything you ever wanted or needed to know about your heart, you're about to find out. We have Dr. Joseph Parrillo, chairman of the Heart and Vascular Hospital at Hackensack University Medical Center. Good to see you, doctor.
Thank you for having me.
So much going on in this field. By the way, ventricular assist device, VAD, put that in perspective, and then we'll talk about heart disease overall. What is VAD?
So ventricular assist device is a assist device for the heart. It basically is an artificial heart that allows the heart, when it becomes very, very weak, to still pump enough blood to sustain life. And we started to produce these artificial hearts in the 1970s and 80s, but they didn't become reasonable in terms of clinical medicine until the last 5 or 10 years. But now they're terrific. They're
Great
really
advancements.
Great advancements, and at Hackensack we have a ventricular assist device program. We put them in patients several a month now, and as you know, the former Vice President Dick Cheney had a ventricular assist device, did very well with his ventricular assist device for several years, and then chose to have a heart transplant.
Well, I'm going to talk about this aortic valve replacement, otherwise known as TAVR, in just a second. Put heart disease in context for us.
So heart and vascular disease are the big killers in America. I don't understand completely, as a heart doctor for 30 plus years, why all the attention is given to cancer and specific cancers. Maybe the people in heart disease don't do as good a job of letting people know about it. But 800,000 people will die of heart disease, and I think very importantly, it produces major illness. It produces heart failure, where you're short of breath all the time, produces stroke, where you can't move one side or you can't talk. I mean, it's not only that it causes people to die, it causes people to be disabled. And it's not recognized, I think, by the population.
You know, beyond the public education piece of this, which you're a part of and you've been talking about for a long time, I'm always curious about the prevention part. I said to you before we got on the air that heart disease is part of the family bloodline, the genetics, if you will, of my family. My grandfather, whom I did not know on my father's side, passed well before I was born. My father's younger brother passed from heart disease, my grandfather from heart disease. My father's had some heart issues. But I guess I said to you, because I exercise on a regular basis, because I have a different diet, because it's a different time, and I'm obsessed with trying to take care of myself, I'm thinking I'm going to beat it.
And you are.
I am, but
yeah.
I have the same genes, don't I?
Yeah. I guess the point that I would make is that the therapies that we've developed in the last 30 years have made an enormous difference. So number one, we're able to control blood cholesterol, blood lipids. Number two, we're able to control blood pressure, very important. Number three, we're able to convince people that they should stop smoking.
That's big.
That's
a big factor.
Big time, and obviously completely preventable. Number four, we control diabetes much better than we used to in terms of the therapies that we have. And people eat a better diet. There's less difficulty with obesity in your generation. However, we're worried, seriously worried about the younger generation, because in fact they're showing signs of increasing obesity.
And a direct correlation between obesity and heart disease.
Absolutely.
The TAVR program, TAVR, put it in context. What is it? Put it in context.
Transcatheter, it means that you're using a catheter, not a surgical incision, aortic valve replacement. The aortic valve is between the major pumping chamber of the heart and the rest of your body.
Right.
And if it becomes narrowed, that's called aortic stenosis. If it becomes narrowed, essentially you'll die eventually. You develop heart failure and other symptoms. And most of the time we do surgery and we go in and replace the aortic valve. However, many patients aren't a candidate to have the aortic valve replaced. They can't undergo the surgery. The surgery is too dangerous.
Because of what, age?
Heart disease of another form, or lung disease, or they've got another kidney disease, things that make the operation itself so serious that you can't operate on the patient. So therefore, we can now replace the aortic valve using a technique where you go into a blood vessel in your leg and you thread a catheter up into the heart, and a balloon expands and actually pushes the old valve out of the way and puts a new valve in, all within about 5 seconds. It's an extraordinary...
How new is this technology?
I'm sorry?
How new is this procedure?
So this has been done now for about a year in the United States.
How successful?
Very successful. We've done some 35 procedures at Hackensack, and other hospitals have also done these procedures. There's been thousands done across the world. Western Europe has done more than the United States. For instance, in Germany now, about a third of all the valve replacements are done by this technology.
A third?
A third.
Before I let you out of here, the research part of this is huge. Research and education. Biggest cutting edge research that we're, the clinical side of this, on the research that we need to be thinking about is what?
Well, I think there's a number of, the technology really is, that we've talked about, ventricular assist devices, transcatheter aortic valve replacement. However, probably the biggest findings are going to be from the cellular level. So for instance, right now we're doing a study. If you have a heart attack, what that means is that one of your coronary arteries got blocked and there wasn't enough blood flow to your heart muscle and your heart muscle died. That is dead muscle now, so there's really not much that can be done about it. However, if we take stem cells, these are cells from your bone marrow,
right.
So from the patient's bone marrow, remove the stem cells and inject them down a catheter into the infarct. In fact, those stem cells, I realize this sounds amazing.
It is amazing.
Turn into heart muscle cells and make the infarct go away. And we're doing that research now at Hackensack and a lot of other places around the country. So now that's research. That's not proven yet. But that's
it causes us to be hopeful.
It does, absolutely.
Dr. Joseph Parrillo, I want to thank you for joining us and putting things in perspective. The reason to be hopeful, but we still have to eat right, exercise, do not smoke.
Very important.
And take care of ourselves. Doctor, thank you for joining us.
Thank you for having me.
Doctors in the house. Stay with us. One-on-one will continue right after this. Thank you very much.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, COHNPREZNICK, providing accounting, tax, and advisory services for more than 90 years. The Russell Berry Foundation, Fedway Associates, Inc., PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons, P.C., and by HealthFirst New Jersey. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.